Hello, this is Commander Kenji, and we will be discussing the abdomen today during this series. Please have your textbooks open to Chapter 7, page 397. We will be discussing the abdomen. The abdominal cavity houses many critical structures that have a large array of functions. It is for this reason that cross-sectional imaging of the abdomen is so essential in visualizing these various organs and body systems. This is image 7-1. The abdominal cavity is the region located between the diaphragm and the sacral promontory. The abdominal and pelvic cavities are commonly divided into four quadrants or non-distinct regions. Contents of the abdominal cavity include the liver, gallbladder, and biliary systems, pancreas, spleen, adrenal glands, kidneys, ureters, stomach, intestine, and vascular structures. The wall of the abdominal cavity are lined by a thin serous membrane called the peritoneum. This is a axial MRI section of the abdomen and pelvis. The dotted line is the peritoneum. You should be able to identify the liver, the pancreas, the spleen, the kidneys, as well as the aorta. And right here is a branch coming off of the aorta. We'll discuss that a little later. Another cross-sectional image of the upper abdomen. This is a CT image, and in this image we should be able to identify the liver, peritoneum, spleen, kidney, and stomach. This picture is located on page 402, actually. It's a great demonstration of the omentum. The greater omentum is a fat-laden fold of peritoneum that drapes down from the greater curvature of the stomach and connects the stomach with the spleen and with the transverse colon, whereas the lesser omentum attaches the duodenum and lesser curvature of the stomach to the liver. Numerous peritoneal ligaments serve to connect an organ with another organ or abdominal wall. Peritoneal ligaments include the gastrocolic, gastrosplenic, and gastrophrenic. Ligaments of the lesser omentum include the hepatogastric, hepatoduodenal, which serve to connect the stomach and the duodenum to the liver. The round ligament is a remnant of the left umbilical vein and runs within the free inferior margin of the falciform ligament to the umbilicus. The falciform ligament extends from the liver to the anterior abdominal wall and diaphragm. There is pathology depicted in this picture, in this image. You should be able to identify the pathology in this image. This is a CT axial image of the abdomen and pelvis. This image here is located on page 410. And it identifies the retroperitoneal spaces. The retroperitoneum structures located posterior to the peritoneum is labeled as the retroperitoneal structures. The retroperitoneum can be divided into compartments with spaces that include the anterior and posterior perirenal spaces and the left and right perirenal spaces. This image is a picture of the the liver. The liver is a large complex organ with numerous functions which include metabolic regulation, hematologic regulation, and bile production. It is also entirely covered by the peritoneum except for the gallbladder fossa. So remember, the gallbladder fossa is not part of the interperitoneal space. The liver is attached to the diaphragm via the right and left triangular ligaments, which are extensions of the coronary ligaments. This is a coronal section of the abdominal cavity, and in it we should be able to identify the liver, stomach, spleen, colon, especially the different segments of the colon, the ascending, transverse, descending, small bowel, urinary bladder. Here we have axial T1 weighted MRI of the liver with the quadrate lobe. In this depiction, we should be able to identify the liver, the portal vein, the stomach, the spleen, the inferior vena cava, as well as the aorta. CT, maximum intensity projection of the portal vein. The liver receives nutrient-rich blood from the gastrointestinal tract via the portal hepatic system. The major vessel of this system is the portal vein, which is formed in the retroperitoneum by the union of the superior mesenteric and splenic veins posterior to the neck of the pancreas. It passes obliquely to the right, posterior to the hepatic artery within the lesser omentum, and enters the liver at the porta hepatis. Axial T1 weighted MRI image of the liver and the portal vein. You should be able to identify the liver, kidney, the crura of the diaphragm, the IVC, and the aorta, as well as the pancreas. I'm using my pointer on these PowerPoints. Hopefully the pointer shows up in the presentation. This is a CT axial image of the liver and portal vein. This is how the portal vein is depicted on a CT image. This is, of course, highlighted by the use of intravenous contrast material. This image can be found on page 423. On this image, we should be able to identify the gallbladder, the liver, the adrenal gland, one adrenal gland, second adrenal gland, or I should say left adrenal gland, the spleen. I'm losing my pointer, I'm sorry, I have to keep, alright, it's not coming back. The spleen, IVC, aorta, diaphragm. I would say that this is part of the kidney, This is a large intestine, We don't want to label this one as yet. We don't have enough information to, as what to call that. Multiple air bubbles in there, if this is small bowel, may indicate some type of pathology associated with it. Axial CT image of the abdomen at the celiac trunk and the hepatic artery, again enhanced by the use of intravenous contrast material. On this image, we should be able to identify the right hepatic artery. The right hepatic artery is a branch of the common hepatic artery, and the common hepatic artery is a branch off of the celiac trunk. Remember, the celiac trunk trifurcates into three vessels. This is one of them, the common hepatic artery. You should be able to recognize the diaphragm is important here, because as the aorta passes through the aortic hiatus of the diaphragm, the first branch that comes off of the aorta is the celiac trunk. The next branch that comes off is the superior SMA, or superior mesenteric artery. But the adrenal glands are apparent on this image. Adrenal gland, as well as the tail of the pancreas, and the tail of the pancreas always points towards the spleen. Axial T1 weighted MRI image of the abdomen and the hepatic veins. You should be able to identify the liver, again the IVC and aorta, the spleen, as well as the vertebra. We didn't really discuss about the bones in the back, but that's the vertebra right there. MRI cholangiopancreatogram of the biliary system. You're going to be very familiar with performing this procedure. It's not that complicated of an MRI procedure, but it does take some experience and expertise so that the images are adequate for interpretation. But the anatomy of interest here is the intrahepatic ducts, the gallbladder, and the duodenum. You want to see the common bile duct, the pancreatic duct, and the common hepatic duct on your MRCP. Sagittal T2 weighted MRI of the liver and gallbladder. Sagittal, this is the liver, kidneys, this is anterior, this is posterior. Lungs showing up black, sorry about that. Lungs showing up black, and there's flow inside of these vessels. So the vessels are showing up white. Again, sagittal T2 weighted MRI of the liver and gallbladder. Axial T1 weighted MRI of the abdomen and CBD. CBD stands for common bile duct. You can follow along on page 431. The biliary system is composed of the gallbladder and bile ducts, both intrahepatic and extrahepatic, which serve to drain the liver of bile and stored until it is transported to the duodenum to aid in digestion. The whitest portion of the gallbladder is referred to as the body, gently tapers superiorly into the neck. The narrow neck lies to the right of the porta hepatis and continues as the cystic duct. The neck contains circular muscles that create spiral folds within the mucosa called the spiral valves of Heister. The intrahepatic bile ducts run beside the hepatic arteries and portal veins throughout the liver. The right and left hepatic ducts unite at the porta hepatis to form the proximal portion of the common hepatic duct. So you have the common bile duct that's formed from the common hepatic duct as well as the cystic duct. So the common hepatic duct drain from the liver, the cystic duct drain the gallbladder, and they meet. Where they meet is the origin of the common bile duct. Coronal T2 weighted MRI of the abdomen and common bile duct. This is important because the common bile duct will have to be located to image the MRCP. If you can't find the common bile duct, you will not be able to obtain a good MRCP examination. So it's important to identify the common bile duct in MRI. This is the common bile duct right there. It's clearly depicted. We have the liver, we have the stomach over there, and we have the small bowel. We have large bowel right there. We have large bowel right there. Vertebral disc, and right alongside of the vertebra is the psoas muscle. We have the dome of the diaphragm right there, and the most inferior aspect of the heart. This is an axial T1 weighted MRI of the abdomen with the head of the pancreas and duodenum. So if you're having difficulty finding the common bile duct, you know that it's going to be in the region of the head of the pancreas right there, and that's the duodenum, because the sphincter of Oddi lays right there in the duodenum, gallbladder, fossa, liver, kidney. So you know that we're aiming or shooting for this region over here. This is the superior mesenteric artery. It's a branch off of the aorta, descending or abdominal aorta right there. It's the second branch after the celiac artery. Left kidney, sorry, I had some technical difficulties. Okay, I am back on track. This is the axial T1 weighted MRI of the pancreas. This image can be found on page 439. And again, we want to familiarize ourselves with axial anatomy. So stomach, important. Liver, important. Beginning of the gallbladder. Pancreas, a feathery pancreas that points to the spleen. We have the kidney coming in here, and we have the bird-like left adrenal and a slit-like right adrenal gland. Coronal CT curve reformat of the pancreatic duct, and generally what that means is the curved reformat is plotting a line that's plotted along the course of the pancreatic duct, so that in one slice we will be able to depict the entire pancreatic duct. And you want this image is very useful for obstruction of the pancreatic duct. It is advantageous to see the pancreatic duct in one continuous image to evaluate for stones, obstructions, things like that. Okay, so we have the gallbladder right there, and we have the duodenum, so we know we're in the region of the sphincter of Oddi, ampulla of Vater. Right, and right there, and we know the ampulla of Vater leads into the sphincter of Oddi, which then secretes the pancreatic fluid right into the duodenum. The eosinophilic process of the pancreas, body of the pancreas, tail of the pancreas, spleen, big bowel, small bowel. Big bowel because you see feces in it. You don't see feces in the small bowel, so when you see the Hofstra markings, and it's easy to depict the big bowel when the Hofstra markings are apparent to you. However, if the Hofstra markings aren't that apparent to you, just look for feces inside of the bowel, and generally it would be large bowel. There is a pathology called the small bowel feces sign, which indicates an obstruction, large bowel obstruction, that has back fecal material and back through the cecum and retrograde into the small bowel. Alright, with this image, we're going to follow along on page 441 and start to discuss the spleen. Okay, this is an axial view of the abdomen with greater and lesser sacs, the falciform ligament, the gastrosplenic, and lineo-renal ligaments. The spleen is the largest lymph organ in the body, composed of lymphoid tissue. The cellular components of the spleen create a highly vascular, spongy parenchyma called red and white pulp. The spleen is attached to the greater curvature of the stomach and the left kidney by the gastrosplenic and lineo-renal ligaments, respectively. The spleen is a highly vascular organ that functions to produce white blood cells, filter abnormal blood cells from the blood, store iron from red blood cells, and initiate the immune response. Red blood cells pretty much have a lifespan of 120 days. So when the red blood cell is ready for destruction, the spleen identifies these particular red blood cells and tags them for destruction. Where is the destruction taking place? In the liver. Cross-sectional axial T1 weighted MRI of the spleen, and here we should be able to identify the IVC, aorta, the crura, or the diaphragm. Of course, the spleen, we were just talking about the spleen, but the splenic vein, the stomach, and the vertebra. And remember that the celiac trunk is the first branch off the aorta as it passes through the aortic hiatus of the diaphragm. The celiac trunk gives rise to the left gastric artery, the common hepatic artery, as well as the splenic artery. This axial T1 weighted MRI image of the right adrenal gland is shown clearly here. Liver, IVC, aorta. You can follow along on page 442. The paired adrenal or suprarenal glands are retroperitoneal organs located superior to each kidney. They are separated from the superior surface of the kidneys by perirenal fat and are enclosed, along with the kidneys, by renal fascia or The adrenal glands are endocrine glands that sit on top of the kidneys, as we just said before. They are responsible for releasing hormones in response to stress through the synthesis of corticosteroids like cortisol, catecholamines, such as epinephrine or norepinephrine. This is the function of the adrenal glands. The adrenal cortex produces more than 24 steroids, collectively called adrenocorticosteroids or just corticosteroids. This is an axial T1 weighted MRI image of the left adrenal gland. Right there, sitting right on top of the kidneys, and you have a little fat pad that separates the adrenal gland from the kidneys, but it is in close relation to pancreas, liver. Nice image of the portal vein here, and the porta hepatis right there, that whole conglomeration of bile ducts, vascular structures. It's called the porta hepatis. Diaphragm, again, left adrenal gland. The structures of the urinary system include the kidneys, ureter, bladder, and urethra. Those that are located within the abdomen are the kidneys and ureters. The bladder and urethra are located in the pelvis, and are discussed later on in chapter 8. We'll cover that when we cover the pelvis. The kidneys are retroperitoneal bean-shaped organs that lie against the posterior abdominal wall on either side of the vertebral column. They are located on each side of the spine between T12 and L4 and are embedded in perirenal fat. This perirenal fat gives the first indication. So here's a good shot of the kidneys, the ureters, bladder, going down into the urethra. Remember that the kidneys are surrounded by perirenal fat, that the nephrographic phase is enhancement of the renal cortex, and the renal medulla is consists of the renal pyramids or calyces. A good depiction of this is figure 7.101, coronal midsection view of the kidneys. Gives a great illustration of how the kidneys lay in the perirenal fat that surrounds it, and the adrenal glands that sit on top of the. This is a sagittal CT reformat of the left kidney. The left kidney is seen here. This is in the nephrographic phase. Why? Because the renal cortex is enhanced and not the medulla or the calyces. Just the renal cortex, the glomerulus of the nephrons, is what's being enhanced here. So we should be able to identify liver, the heart, small bowel, big bowel, iliac wing. Coronal CT reformat of the kidneys. Image can be found on page 448. The window is darkened, I guess, wide gray area, so that we can see through areas of high contrast. But here we do see the left and right kidneys very well. Again, it's the nephrographic phase. Lay right lateral to the psoas muscles. You have the calyces. Again, that's the cortex, and the calyces, the renal pyramids, would be the medulla. Picture of the right adrenal gland that sits superior to the kidneys. Axial T1 weighted MRI of the kidney. Vertebra with the psoas muscles, kidney, duodenum, superior mesenteric vein. Adjacent to it, medially, is the superior mesenteric artery. Remember, if you have an image like this and you test it on an image, remember how the IVC lays with the aorta. The IVC lays to the right of the aorta. So when you're looking at the mesenteric vasculature, the superior mesenteric vein is going to lay to the right of the superior mesenteric artery. Colon, again. Axial T1 weighted MRI of the stomach. Now, we don't really do MRIs to look at stomach pathology. The resolution of MRI to visualize small structures in the stomach, such as ulcers, is not suitable for interpretation. However, we do see the stomach on MRI as well as CT, and it's the fundus of the stomach, the dependent portion of the stomach when laying supine. Close relation to the stomach, but posterior to the stomach, is the spleen. Again, the liver, IVC, aorta with the diaphragm. Axial T1 weighted MRI of the pyloric antrum and pyloric sphincter. So we have a picture of the stomach, the elongated portion of the stomach, and at the end of the stomach, before it enters into the duodenum, it goes through the pyloric antrum. This antrum is a great spot for stenosis or ulcerations, hardenings, and then there's the pyloric sphincter right there, that circular muscle that either is constricted and keeps the contents inside of the stomach, or is open and allows the contents to pass through to the duodenum. Axial T1 weighted image of the MRI at the duodenojejunal junction. This image can be found on page 460. And anatomy of interest here, of course, would be the kidneys, the aorta with the IVC. Remember, the venous system demonstrates capacitance, or the ability to become stretched out, elongated. The muscular wall of the arterial system is much stronger because it pulsates, have to pulsate the blood throughout the body, whereas the venous structures muscular wall is much thinner and demonstrate capacitance. So when you look at venous structures, they may not be a perfect circle just because of that muscular layer of the vein. It's just not as structurally sound as arterial systems musculature. But again, we have the superior mesenteric vein and artery. Of course, you have the superior mesenteric that's going to be located on the right. Good correlation to the inferior vena cava there. As far as it's being inferior mesenteric arteries, it's not that critical that you know that, as much as it is critical for you to know that this is the superior mesenteric artery. Coronal T2 weighted MRI of the cecum, page 463. And what's important here is the ascending colon is retroperitoneal and commences at the cecum, ascending the right lateral wall of the abdomen to the level of the liver. It then curves sharply to the left, creating the hepatic flexure. The hepatic flexure marks the beginning of the transverse colon. The transverse colon travels horizontally across the anterior abdomen toward the spleen, where it bends sharply downward, creating the splenic flexure. And also recall that the transverse colon lays anterior to the ascending and descending colon when viewing. Coronal MR colonography. And colonography is hot topic now. Direct visualization is the gold standard. However, CT colonography is quickly approaching that gold standard. MR colonography is behind, however, as you can see in this image, rapidly gaining a foothold in that market. But here we can see great picture actually of the ascending colon. And the ascending colon, actually, this junction right there by the cecum can be stretched much wider, or should be typically much wider than the rest of the intestine. 6 to 9 centimeters across is a typical normal width of the cecum. You see the haustral markings. Here we see small bowel loops, transverse colon, and here, since we're talking about the left, we would be talking about the splenic flexure of the colon. You got descending colon here. Axial T1 weighted MRI of hepatic flexure and transverse colon. Image is on page 465, and T1 weighted image, so it's an image of anatomy. You can see the kidneys very well. You can actually even see the renal artery that stretches and goes posterior to the IVC and enters into the aorta. You can actually see the left renal artery extending off of the aorta. The renal vein courses anterior to the aorta and enters into the inferior vena cava. Axial T1 weighted MRI of the splenic flexure, liver, kidneys, vertebra, kidney, splenic flexure of the colon, stomach. Well, how do we know the stomach? Because there's an air bubble in there. And remember, you got the pyloric antrum. From the pyloric antrum, we have the pyloric sphincter leading into the duodenum. Axial T1 weighted MRI of the sigmoid colon. And here we really don't have a decent representation of the sigmoid colon because it is extremely collapsed. This is intra-abdominal fat. You could tell that because you can look at the grayscale of the fat of the surrounding abdomen and correlate that with the grayscale of the fat and come to the conclusion that it is intra-abdominal fat. But this does give a good picture of the gluteus minimus. This is the border right here of the gluteus minimus, the gluteus medius. So all this is the gluteus medius and the gluteus maximus, which is all this muscle right there. MRA of the abdominal aorta. This picture is 769. This is a very good MRA of the abdominal aorta. Shows all the branches very well. Aorta, right and left renal artery leading into the kidneys there. Bifurcation of the abdominal aorta into the common iliac arteries. This would be the left common iliac artery. That would be the right common iliac artery. And then the iliac arteries further bifurcate into the internal and external arteries. The internal iliac arteries vascularize the pelvis, perineal area, uterus, bladder. The external iliacs go course further down and turn into the femoral arteries. Axial T1 weighted MRI of the abdomen with renal arteries and veins. An important picture, I guess less likely for MRI because of the filters that can be placed in the IVC to stop blood clots. However, the renal arteries and veins are important structures because the filter has to be located inferior to this area so that blood clots do not enter into the renal vasculature. But this, again, axial T1 weighted MRI image of the renal arteries and veins. Here we can see the lumbar muscles, kidneys, and you can course this right into the aorta. So if you course it right into the aorta, of course it has to be the left renal artery. This structure courses anterior to it, so this is the left renal vein. And if you look at the structure, it's going to course right in front of the aorta to enter into the IVC. Nope, we just talked about this image, so we're not going to stay here too much longer. The IVC coursing right to the right of the aorta. Again, right internal iliac artery that feeds the pelvis, the organs in the pelvis. It just jumped here, so I'm just gaining my bearings, I'm sorry. Axial T1 weighted MRI of the abdomen and gonadal arteries and veins. So the gonadal vein and artery is coursing from I'm trying to get a look here to see, because sometimes as a normal variant is actually quite normal for the left gonadal artery to come straight off the aorta while the right gonadal artery comes off of the renal artery. But here you have the gonadal vein and artery. Remember, the vein is going to be on the right side, the artery is going to be on the left. And again, if you're trying to differentiate between the vein and the artery, remember the artery is more or less a complete circle, where the vein again has to exercise capacitance and therefore might be oblong in this presentation. If you follow along on page 473, it reads, the gonadal arteries originate from the anterior wall of the aorta just inferior to the renal arteries. They descend along the psoas muscle to reach their respective organs. In the male, the gonadal arteries are termed the testicular arteries, which supply the testes and scrotum, whereas the gonadal arteries in the female are termed the ovarian arteries, which supply the ovaries, uterine tubes, and the uterus. Axial T1 weighted MRI of abdomen with the celiac trunk. Again, we see the celiac artery coming off of the aorta as it passes through the diaphragm. Liver, IVC, porta hepatis, stomach, adrenal gland. We have the pancreas pointing to the spleen. T1 weighted MRI of the abdomen with the left gastric artery. Remember, the left gastric artery is another vessel branching off of the celiac trunk. Again, liver, portal vein. This is the stomach, and this is the left gastric artery that's about to supply blood flow to the stomach. And there's the spleen. So the splenic artery comes off, courses back, and supplies blood to the spleen, or the gastric artery supplies blood to the stomach. Axial T1 weighted MRI of the splenic artery. The splenic artery is the largest branch of the celiac trunk and passes to the left behind the stomach and along the upper border of the pancreas within the splenorenal ligament to the hilum of the spleen. At the point where the splenic artery courses near the border of the pancreas, it gives off numerous pancreatic branches, including the dorsal, great, caudal pancreatic arteries that supply the body and tail of the pancreas. This is an axial T1 weighted MRI of the superior mesenteric arteries, and of course we need to see or visualize the superior mesenteric vein, superior mesenteric artery. Remember, the vein could be larger because it expands. Kidney, IVC, aorta, renal artery, piece of the pancreas, colon. Axial T1 weighted MRI of the renal veins. And this image can be found on page 487. Blood leaves the kidney by way of the interlobular veins that carry blood from the renal cortex to the arcuate veins, which carry blood from the medulla to the interlobar veins. The interlobar veins drain into the segmental veins. The 5 segmental veins correspond to the respective segmental arteries and merge to form the renal vein. So this is how blood supply returns from the kidney to get mixed back into the systemic blood flow via the venous system. Page 488, this is the lymphatic system. The lymph nodes that are closely adherent to the vessels themselves can identify pathology early if they are indeed enlarged. Many lymph nodes exist within the abdominal cavity. Abdominal lymph nodes occur in chains along the main branches of the arteries of the intestine and abdominal aorta. Most abdominal lymph nodes appear as small, oblong, soft tissue masses oriented parallel to their accompanying vessel. Lymph from the abdominal cavity empties into the lumbar trunks, which drain lymph from the legs, lower abdominal wall, and the pelvic organs, and the intestinal trunks, which drain organs located within the abdominal cavity. These trunks then join the thoracic duct and ultimately enter the venous system. This is an axial T2 weighted MRI of the psoas and quadratus lumborum muscles. This image can be found on page 491. And so let's discuss the muscles. The abdominal wall is formed superiorly by the diaphragm and inferiorly continuous with the pelvic cavity. Remember, the diaphragm is indeed yet another muscle. The quadratus lumborum muscles forms a large portion of the posterior abdominal wall. The large psoas muscles extend along the lateral surface of the lumbar vertebra to insert on the lesser trochanter. Psoas going to the iliacus muscles. The paired rectus abdominis muscles, the ones we love, the six-pack, visualized on the anterior surface of the abdomen and pelvis, originate from the pubic symphysis and extend vertically to the xiphoid process and costal cartilage of the 5th, 6th, and 7th ribs. A longitudinal band of fibers that form a central anterior attachment for the muscle layers of the abdomen, is the linea alba, which extends from the xiphoid process of the sternum to the pubic symphysis. The external and internal oblique muscles are located on the outer lateral portion of the abdomen and extend from the cartilage of the lower ribs to the level of the iliac crest. Call them the oblique muscles. You can see them actually when you work out. And I guess page 7 Page 492, figure 7.185 demonstrate the abdominis rectus, or the rectus abdominis muscles very well, as well as the external obliques, the internal obliques course. I don't want to say opposite, but cross the external obliques. Also gives a great picture of the linea alba. Again, that's page 492. That concludes our discussion on the abdomen.